Hello, thank you for coming back to Mastering Thought with Dr. Mark Waller and Christina Black, where we talk about the mind, marriage, and mental health. And today we have a very special mental health topic, I think, and mind, with our guest, Michael. I don't know how to pronounce your last name. I'm sorry. How do you pronounce
Pedagorsky.
it? Pedagorsky. I'm so glad I didn't attempt that.
Well,
No
I'm
worries.
glad you did it instead of me.
Well, Mr. Pedagorsky is coming to us from a company called Mindbloom, and they do ketamine therapy. And we're really excited to explore this topic with you, Michael. Thank you so much for coming on today.
Oh, my pleasure. I really appreciate you bringing me on.
So
Yeah.
Christina and I have been talking about getting somebody on to talk about psychedelics
Mm-hmm.
and ketamine specifically.
Yeah.
And I reached, I saw you on X. No, I saw your ad, I think on X.
Mm.
And I thought, I was just so intrigued. I thought, oh my God, somebody's doing this. Because
Mm-hmm.
Mm.
Christina and I actually had been talking about providing it in our area, and we're sort of lost as to how to proceed. And when I saw your ad, I reached out to you and you came right back. That was awesome that you did that. I really appreciated that.
Mm-hmm.
So tell us
Yeah.
a little bit about Mindbloom
Yeah.
and where this all came from. And you're the chief strategy officer. And I know you've got a law degree from Fordham University. Is that correct?
That's right. Yeah. When I was in law school, I never thought I would be working in psychedelic therapy. I'll tell you that much. The
Mm-hmm.
has come a long way. The country has come a long way in terms of viewing this not as something on the fringes, but really a mainstream
Mm-hmm.
mental health treatment. And
Right.
I think really that's in part because the science and the evidence behind it has really become impossible to ignore. At the same
Yeah.
time as we've seen a mental health crisis grow worse and worse, we've seen more and more studies showing that ketamine and other psychedelic medicines can be incredibly effective, fast
Mm-hmm.
acting, and safe treatments. And so, as the science
Mm-hmm.
has developed, acceptance has too. And yeah, happy to share a little background on Mindbloom. The company was actually started by one of my closest friends, a guy named Dylan Binen, who I met in college and is, a really exceptional person, but lost both his mother and his sister to fentanyl overdoses after
Oh,
years of mental illness and
wow.
addiction. And psychedelic medicines were what let him not fall down that same path. And
Mm-hmm.
he said, what can we do to make these accessible to more Americans, especially, these people suffering from depression, anxiety, trauma, addiction.
Mm-hmm.
And, unfortunately today and for the last few decades, every psychedelic has been illegal. They are
Right.
scheduled in Schedule 1 under the Controlled Substances Act, which means, according
Right.
to DEA, they have no accepted medical uses and a high risk
Right.
for abuse. Now,
Right.
we know
Mm-hmm.
that first part isn't true. We know there are medical uses for these medicines, but ketamine is approved by the FDA and it is legal to prescribe. And so Mindbloom really started there. The mission is to transform lives, to transform the world. This is not a ketamine therapy company. This is a mental health company that wants to enable people to live richer, happier, healthier lives. And we started with ketamine therapy, but certainly the plan is to bring more psychedelic medicines to people and providers as soon as those medicines become legal.
Mm-hmm.
So,
Yeah.
like so many things we do in this country, we really messed this whole psychedelic thing up about 35, 40 years ago. And I was telling Christina the other day, there is I believe you found it, didn't you? It's a documentary on MDMA
Yeah.
by Peter
The
Jennings back
Ecstasy
in
Rising. Ecstasy Rising is what it was
uh,
called.
Wow.
right.
And I think it was
And,
Reagan. It was during Reagan's campaign and
right.
he and his wife, Nancy, right?
Yeah.
But
Well,
yeah, interesting.
what was the tie in with Reagan?
Oh, like his wife in particular was very concerned about what was happening with the youth and psychedelics and it just kind of seemed like though there were positive things that never got any coverage. And then it was kind of interesting, at least in the documentary. I didn't keep looking into it, but it seemed like when they were supposed to explain why it was bad, they would only say it puts holes in your
Right.
brains and it's so bad for you. But they
Yeah.
like,
Yeah.
I didn't see anything in the documentary that really said why it was bad for you or what they were concerned about. And even like other professionals looked at the pictures that they used to say it puts holes in your brain and said, this is a thermal picture. It's not showing you there's holes, it's showing you there's a different temperature.
And
But
Yeah.
like they knew it, but they didn't care.
the fact is that even back then in the 80s, there were, for instance, women who had been severely abused and raped and had horrible trauma. One session of ecstasy would
Yeah.
cure it.
Yeah.
And
Right.
so,
And they would
you
even,
know,
oh, go ahead. Sorry.
well, I'm just saying, we've wasted a generation in
Mm-hmm.
not exploring
Yeah.
psychedelics adequately. And from
Yeah.
my point of view as a therapist for 25 years, I can tell you there's so many people that could have been treated with this
Yeah.
that weren't able to get access to it, and they had to go. If they did, they went to Mexico or Peru or
Yeah.
some place, and
Mm-hmm.
who knows what happened
Mm-hmm.
there. But
That's the
Michael,
real
I'm
tragedy
just
of this.
I'm excited that you guys are mainstreaming this. It's really
Mm-hmm.
important.
Mm-hmm.
Yeah, and I'm sorry for talking over you there. It is a real tragedy. I mean, there's a great book by James Fadiman called The Psychedelic Explorer's Guide that
Yeah,
is both a guide and an incredible history of these medicines. And what you see there is that there was actually incredibly promising research into LSD, psilocybin,
Mm-hmm.
MDMA, these other
Mm-hmm.
substances, and showed them to be really promising going back to the 50s and 60s. And in this war on drugs, and I think a real reaction to
right.
the counterculture, which was the side of the culture war, advancing these medicines, it was really viewed as a threat. And so they were restricted and research was stopped. And it meant that generations of people who, went to Vietnam, who went to these other,
Mm-hmm.
wars, came back and couldn't get treatments that could have helped them. And I think, you touched on this a moment ago, but today in our veteran community, there are so many people who come back traumatized from war, see the research behind psychedelics, whether it's ayahuasca or ibogaine or psilocybin or something else, can't get it here and have to go to some underground clinic in some other
Right.
country or something worse than a clinic. They're so desperate. I mean, today, 17
Yeah.
veterans commit suicide every day. And,
Wow.
we can get
Oh.
into the MDMA situation more specifically, but FDA was presented with an application to approve MDMA assisted therapy in August and
Yep.
rejected it. So go run another phase 3
Right.
trial. And,
Well,
Right.
to
that's
your point a moment ago about holes in the brain, there really wasn't scientific evidence saying this is not safe. FDA
Right.
basically said we want to see more data on safety. There was no specific, credible risk that was
yeah,
identified. And my
yeah,
question for them would be, is the risk of this medicine so great that we're willing to accept 55,000 suicides in a year,
yeah.
17 veteran suicides every single day? I would say no, and
Mm-hmm.
that's part of what we're here advocating for is we need our
Yeah.
government to make a real risk benefit analysis, and we're not asking them to blow the doors open, but let people in need get these medicines under a proper appropriate supervision.
Well, I'm sure
Mm-hmm.
that big
Absolutely.
big
Yeah.
pharma doesn't want an alternative.
Yeah.
And we all know by now that the FDA, 50% of their funding comes from big pharma. So,
That's right. And the
Yeah.
number is even higher when it comes to the budget for drug review and approval. I think that's something like 75 or 80% comes
yeah,
from user fees in big pharma.
yeah,
And so, yeah, you'd better believe that when they sell a pill you take every day for the rest of your life and
right,
someone else presents a medicine that, cures people in 3 sessions. I mean, MDMA therapy in the trials for that, 87% of patients reported clinically significant improvements after only 3 medicine sessions.
right.
67% no longer met the criteria for PTSD, and that's after 3 treatments plus psychotherapy. And
Right.
so,
Wow.
yeah, you better believe that the companies that are spending $17 billion a year to advertise their drugs don't want those medicines approved when they can't get patents on them themselves.
Let me just make a
Mm-hmm.
real quick comment about that. My experience as a psychotherapist is that the people that struggle with those conditions the most are the least likely to be able to do insight therapy to begin with. And so their only alternative is some kind of alternative like ketamine or some
Mm.
other psychedelic. And
Yeah.
it's been very tragic for me to watch them come in and out of my office and me not really be able to treat them because they just don't have that capability.
I think that's right. And I
Yeah.
think, there are a couple different ways that psychedelics can help people. Sometimes they actually do alleviate the symptoms and provide insights that people can use to create lasting change. But in other cases, they even if they don't do all that, they place people in a state where they can begin the healing process
Right,
with a
Hmm.
therapist or other
right,
Hmm.
right.
guide or person working with them. Take me. I've struggled with social anxiety since I was a kid, and when I'm in a really agitated, high activation state, if you say, "Mike, just meditate," that doesn't help me. I can't just sit there and
No, no.
meditate. I have to get myself back down before I can do that. And I think
Yeah,
it's
Right.
similar with
absolutely.
trauma or anxiety or depression. Sometimes you have to get yourself into a state where you can really intellectually start healing your soul and your brain and your mind, and
Yeah.
psychedelics can help you get to that place.
So tell me
Hmm.
your personal story of how you got into this as a result of your treatment.
Yeah. I was a client before I worked here. And, as I mentioned, Dylan's been a friend. And so as a lawyer, I was definitely someone he was talking to about wanting to start this company. But
Hmm.
I have always been, high functioning, but I have struggled with social anxiety pretty severely since I was a kid. And it manifests in chest tight, sweating, shaking, can't focus
Yeah.
on anything else, tunnel vision, and that extreme fight or flight response. I mean, I
Right.
cannot tell you how many times I walked out on a date, a job interview, my high school graduation. I mean, any number of things because I panicked. I start sweating and shaking, and I have to flee. And I would make up all kinds of excuses. And I mean, it really,
Hmm.
things like dances, prom, out of the question. And I just suffered with it. And I tried psychotherapy. It didn't really help me. I tried, I went to psychiatrists and was prescribed beta blockers and Klonopin. And
Oh my God.
they they could help in acute situations, but at a really brutal price. When I would take
Right.
Klonopin, I didn't form new memories, and so I would basically black out.
Right.
And so I would have this real Faustian bargain of I can take these pills and get through this event, but I won't really remember what happened. Or I can cross my fingers and hope for the best. And it's one thing when it's a date or a dinner with a bunch of people. It's another when you're a trial lawyer
Oh,
and you're expected to go into and argue a case and be in front of a
Wow.
judge. Yeah, you can see the problem. And so
Hmm.
I medicated my way through more events and things in my life than I would care to admit and forgot them along the way. And it
Yeah.
just felt like my lot in life. And I
social
covered it up. I
anxiety
masked.
is social anxiety is very difficult to treat.
It was difficult for every provider I worked with. Pretty much
Yeah.
all of them threw up
Hmm.
their hands.
Right.
And ketamine therapy was the first thing that helped me. And I can tell you kind of how it helped me, and I can walk you through a little bit what that process was like.
Go
But
ahead.
Please do.
for yeah, I mean, the first time I took ketamine, I went in really with an intention of working on this issue. And we can talk in a minute about, intention setting and all that goes into it. But in
Hmm.
that first I took the ketamine, I closed my eyes, and I had this vision of myself it was basically an igloo. And I'm in this igloo and it has different doors. And each door is a door to a different situation that would cause me this intense anxiety, a date, a job interview, a presentation, a court hearing, whatever it is. And I could go through and experience being there, but without all the anxiety, without the physical sensations, and without the spiraling and fight or flight,
Oh,
and just be there. And it
wow.
was the first time I had been able to internalize this idea that there's not some inextricable link between a stimulus and the response or the situation and my feelings about it. And I was able to be in those places, not start sweating, not start heart racing, not start feeling anxious, and really like just be there. And it was the first time I could see that daylight and experience that kind of sense of it's okay. It doesn't have to be this way. Change is possible. And from there, I was able to revisit that place in more sessions, and between sessions, work on it where I might be walking into or experiencing one of those situations or get that stimulus and go, aha, I'm seeing the start of that spiral. What if we just say, not this time? Not
Right.
this time. Today, I don't spiral. Today, I don't walk out. Today, I say, screw it. If I'm sweating a little bit, I'll live. I'm fine, And really, it didn't all click at once, but working on that through, weeks and really over the past few years, I mean, just to kind of put a cap on it, earlier this year, I sat on a panel at a conference in front of, a couple hundred people. And it was the first time I did public speaking without any
Wow.
pills in, decades. And
Wow.
to have that experience, I mean, I get chills thinking about it now. Just to get that far, it was like such an incredible feeling, and also just such a testament to the power of this medicine, which, helped me where nothing else had.
So let me ask you a question. How is ketamine a psychedelic, or does it just mimic the same qualities of a
Yeah,
psychedelic?
it's a great question. And the experience of ketamine is unique, and it is different from other psychedelics. It's a little hard to describe. Psychedelics are kind of like describing a new color. If you've seen it, but nobody else has, it's a little hard to relate it, but I can try. Ketamine is often described as a dissociative. And
Okay.
what that means, at least in my experience, is it separates you from your normal thoughts and feelings. So you're not you sitting behind your you glasses watching everything through the same lens. Maybe
Right.
you have a bird's eye view on it. Maybe you have someone
Right.
else's perspective. I mean, I've literally had ketamine therapy sessions where in my mind, I had one, actually one of my more recent ones. I was thinking about people I work with, and a carousel of their faces was going around, and there wasn't me watching them. I actually didn't even know which of those faces I was. It was just like, this is the place I work. These are the people in this place. And it wasn't me watching it. It was just this thing that is. And so this dissociative experience really kind of separates you from your own baggage, from your own patterns, your assumptions and beliefs, and so you can kind of see things from an objective perspective and understand them differently, or see different ways. Rotate the shape a little bit. It's like the parable of the blind men feeling the elephant and trying to describe it. All of a sudden, you're seeing the whole elephant instead of just the piece that you're holding on to.
Okay.
And that's, I think, unique to ketamine. MDMA is very different. That's very, they call it empathogenic. And so you're very much yourself, but you're really experiencing your feelings and relationships with others. It really is about you, and often these feelings of self-love, tenderness, care, appreciation. It's not a classical psychedelic in the way that you might have seen in a TV show or movie. It's really something that kind of makes you feel connected and loved, both with yourself and with others. And then something like psilocybin or LSD or even ayahuasca are more classical psychedelics, which is, again, kind of a different category. It can have some of that ego dissolution and selflessness, but it can also mean intense reflection on one's life. Not with that same emotional valence always, but often with like purpose, meaning, place in the universe, and a broader perspective of what is this thing we're all experiencing with consciousness and existence.
Okay. Christina, question? You're muted. You're muted. This raises a question for me. The way you described your experience with ketamine sounds a lot like the default mode network was shut off.
Yes, that's absolutely right. So, there's with ketamine, there are really two aspects to it. There's the felt experience, and then there's, what's happening behind the scenes on a neurochemical level. One of the things that ketamine is doing is quieting the default mode network, which is that
Right.
part of our brain that is self-referential. And, sometimes that self-reference can be valuable. It's how we operate in society and how our behavior, might affect others. And At the same time, it can be the source of rumination, self-criticism, self-doubt, that voice that so many of us have in our heads saying, you're not good enough, you did this wrong, you failed. And it really does quiet that. I mean, the neuroimaging studies have shown that the communications in that part of the brain are quieted when you take ketamine. Another big thing that's happening is ketamine is working on the glutamate system and stimulating the production of something called brain-derived neurotrophic factor, or BDNF, which is kind of referred to as fertilizer for the brain. In studies of people with chronic, major depressive disorder, uh, the neural activity in parts of the brain associated with emotional regulation is stunted. There's just less communication between neurons and few neural connections. And when you stimulate the production of BDNF, you actually stimulate the growth of new neural connections and the health of existing connections. And so, in a very literal sense, it is helping your rewire your brain and help you, build healthier, more robust communication in the parts of the brain that regulate your emotions and thoughts and feelings. One analogy that I've heard used for ketamine that I think is really apt is when you have anxiety or depression or trauma or other issues, you build these thought patterns and they kind of wear grooves in your brain. And so you fall into them over and over again.
Right.
And so, for me, it might be, oh, I feel it's warm in here. I'm going to start sweating. And then I started sweating. And then I get this self-referential, or people seeing me sweat, or people seeing me anxious. Oh my God, what if they think I'm, and then I go down that track. And ketamine, it's kind of like if you're skiing, you go down these worn tracks over and over. Ketamine's like a fresh coat of snow. And all of a sudden you can lay down some new tracks. And those new tracks in a literal sense are those new neural connections. And in a
Okay.
kind of metaphorical sense, there are these new ways of thinking or patterns that you can actually build when you have that, fertilizer in the brain.
Mm-hmm. Hmm. Well, thank you for the description and breakdown of the differences
Yeah.
and the pros. That was really
And I,
interesting.
oh, sorry. I
Oh,
mentioned before, sorry, I didn't mean to cut you off, please.
it's okay. Go ahead.
Well, I mentioned before, like going into that first session, setting an intention. And, there's a part of this I did want to touch on, which is, it's not just taking the medicine. There is work that goes into this. And it's really interesting because, and I think this is, similar to what we were talking about with issues with big pharma. There's this desire in the research and kind of clinical world to run these really tightly controlled trials that
Right.
only isolate one variable and study it. And there's merit to that, certainly, but most of the research around ketamine was done in that vein. And so the only intervention is take the medicine, period. Our hypothesis at Mindbloom, which we think is borne out in the evidence, is that ketamine as a medicine, as the only intervention, is really helpful. It reduces symptoms of depression and anxiety, but when you do other work around it, whether it's preparation, integration, therapy, things like that, you can increase both the magnitude and the duration of the benefits. You can see better symptom improvements and make them last longer. And so
Mm-hmm.
our core hypothesis at Mindbloom is that when you pair the medicine with coaching, content, and community, you actually can provide a more effective treatment for the people who come to you for help. And so, what that looks like is a few things. As I mentioned, it's not just like a daily pill, you get your brain fertilizer and move on. You have these sessions, they're usually spaced about a week apart. And for each one, you really do need to cultivate the right set and setting, your mindset and your physical setting in order to be in a place where you can, uh, you know, see benefits from this medicine. I mentioned a minute ago, if I'm all agitated and worked up saying, Mike, just meditate doesn't work, right? Well, it's kind of the same here. If I am work, if I put down my computer and go take some, ketamine, I might not have anything helpful happen, but you do this preparation work of setting intentions, journaling a little bit. What do I want to work on? What am I feeling? What am I here to do? How do I think this
Okay.
can improve my life and the
Mm-hmm.
life of my family, friends, colleagues, people around me? And you do this work going into a session to really set yourself up for success. But when you set an intention, you also have to let it go. You walk into the session, you don't want to be putting your stake in the ground and clinging for it to dear life, because the medicine takes you away from yourself a little bit. And if you fight to hold on, you can also have a weird experience. So it's like setting an intention and then casting it into the wind. And then you have to kind of let go and be open to this experience. But the
Mm-hmm.
preparation is what needs you to do that. And
Mm-hmm.
then, during the session, you have an eye mask on, you're turning inward, you're listening to some audio. It can be spoken word or music or nature sounds, depending on, your own preferences. But after the session is this process of integration. And this is what's so important is, in our programs, we pair everyone with a guide. This can also be done through psychotherapy or through other forms of psychosocial support. There's no one size fits all model, but really it's unpacking the experience. What did you see? What did you feel? What did you not experience or feel? Looking at what's not arising is also important, and translating that into insights about yourself and then into actions you can take. And so often, the work that you do after and between sessions is the most important part, because you're trying to take something and turn it into a practice, turn it into a real change. And so what our
Mm-hmm.
programs are doing is really helping people not just get the access to the medicine, but do this preparation and do this integration to really see long lasting benefits.
Mm-hmm. That's so neat. So I do a body work called craniosacral therapy. Have you heard of that? Are you familiar with it?
I have heard of it. I'm a little familiar with it. I certainly wouldn't pretend to be an expert.
Sure, sure. So it's a nervous system therapy, and when you work the nervous system, eventually you start having to learn philosophy and psychology and all that stuff, because in our bodies we don't just hold physical tension, we can hold emotional tension in the body itself. And I see a lot of similarities between use of psychedelics, including ketamine, and that therapy. And it's really beautiful. I mean, I think this is showing us a system in the body that our non-conscious has a will for us. And when we don't live in alignment with the values it has, our life gets unhealthy, whether it's through mental issues or physical issues or both, or just like a downcast spirit. But what I'm really seeing that I think has similarities is that while you're on ketamine, it makes you feel very safe.
Mm,
It makes you
yeah.
not have fear to look at the things that were the issues for you. Is that fair?
Absolutely. And I think you just touched on
Yeah.
something that's really important. I'm glad you brought it up. But one of the really interesting things about ketamine therapy and other psychedelics, too, is that they often do help with physical pain. And it's not
Mm-hmm.
just in the session, but afterwards. I mean, I herniated two discs in my back in college and had back surgery about 10 years ago. And I am amazed after I do a ketamine therapy session how much better my back will feel and for how long. And I think it's
Mm-hmm.
because there is this connection between our emotional state, our physical state, our
Mm-hmm.
tension, how we hold our bodies, the way we
Mm-hmm.
move, just even stuff that's farther down the level of abstraction. But these medicines really do help people release a lot of that tension, that restriction, that tightness. And I think
Mm-hmm.
for physical pain, they can be really valuable too. And
Mm-hmm.
what you just said about safety, I think, is really true too. There's a certain, it's like comfort, acceptance, and yeah, I think when you do these medicines, there's often a real sense of feeling protected by oneself, by nature. But if people are spiritual, they often feel like a spiritual comfort.
Mm-hmm.
And I've certainly had experiences where with psychedelics where you feel this broader connection to the universe in a way that's incredibly comforting and kind of gets you out of your human
Mm-hmm.
problems a little bit and into a sense of like this life is wonderful, it is okay. And that sounds kind of
Mm-hmm.
simple, it's really profound when you feel it and kind of can bring
Mm-hmm.
that into your daily life.
Yeah, it's just like a new interaction with consciousness, you know? Just like I'm
Yeah.
here, but it doesn't have to be in the same way.
Yeah, well, that's just it. They show you that there's just this incredible power of experiencing the world differently. your
Mm-hmm.
thoughts can change. I mean, that, that
Mm-hmm.
book and documentary by
Absolutely.
Michael Pollan, How to Change Your Mind, it's easy to kind of let that pass by, but what he's saying is really serious. You can change your mind. You can change your experience of daily life. You can change feeling anxious. You can change feeling scared. You can
Mm-hmm.
change feeling unloved or unworthy. It's like,
Mm-hmm.
it's an incredibly powerful set of tools. And the thing that we're working on that needs to happen is showing people how to use these responsibly and in ways that can help them, and having more providers be educated about these so that they can have this in their tool belt to help the people that come to
Mm-hmm.
them, whether it's for spiritual pain, emotional pain, physical pain, whatever it is.
Yeah, that's
So
so neat.
if you're listening to this and you like what we're talking about here, please like and subscribe. It gives us the power and the motivation to go forward. Interestingly enough, we discuss the default mode network quite a bit on this channel, and part of the function of the default mode network is to create a narrative around the pain,
Hmm.
and I call that suffering. And so when you, whether it's through ketamine or psychedelics or the technique that we teach, when you disidentify with the narrative, the suffering goes away. And
I
so
think that's
that may
true.
seem like the pain goes away too. Maybe it does, but most of what people experience is suffering and not actually the pain itself.
Yeah, I
That's what
think
we've
that's so
discovered.
right. Yeah. So I'm not sure. Are you familiar with Sharon Salzberg?
That name doesn't ring a bell. No.
Mm.
Sharon Salzberg is a wonderful meditation teacher. I mean, I don't know if that's how she would describe herself. She does a lot of loving kindness meditation, and she talks about something really similar. And I think it's yeah, there's a certain identification with pain
Right.
or with
Mm-hmm.
suffering. I am a person who has back pain, or I am an anxious person, or whatever
Right.
it
Right.
is. And
Right.
Mm-hmm.
then we focus on the identity more than the sensation itself. And one
That's
of the things that she teaches that I think is so powerful, that sounds like you all are aligned with also, is really examining these things and unpacking them. What am I feeling, pain, or am I feeling fear? Or am I feeling
Mm-hmm.
frustration? Or am I feeling something else, or some combination of things? And when you can start to peel back those layers, you can let them go. And what's left is often something much more manageable or smaller than it was before.
Well,
Mm-hmm.
just to
Um,
tell you what we do here is we teach people how to disidentify with the voice in their head,
Mm.
while not on
and
psychedelics.
but not on
Yeah,
psychedelics, which
psychedelics not required.
and when they have that moment
Similarly.
where they realize they're not the voice in their head, all of the tricks of the default mode network go away and the suffering goes away.
Yeah.
And so, but my interest in this whole thing is that works great, except for a group of people that can't actually do that kind of insight. And it seems to me that ketamine kind of kicks that whole thing into high gear for those people.
I think you're 100% right. I think it's a wonderful tool for that, for getting a little distance and seeing the
Right.
difference between you and your thoughts, or between you and your identity, and
Mm-hmm.
just
Right.
separating
Mm-hmm.
those a little bit. The analogy I've heard Sam Harris use that I thought was wonderful is, psychedelics can often show you where the peak of the mountain is. And when the experience is over, sometimes you're back down the mountain, but you at least know where it is. And the practice, the work you do in between, is getting your way back up that mountain. But when you know what to aim for, when you've had that moment, even just in a blink of being separate from that identity, you
Mm-hmm.
know that it's possible. You know you can work towards it, but you
Right.
have to see it. You have to feel it for a minute sometimes to know where you're aiming.
Yeah.
Well, you know that you know. You can't
Yeah,
unknow.
it's possible. Yeah, that's right. That's right.
I have a question, but it might change the topic. So if we need to delay it, that's okay. But I just kind of think about more and more how like culture does have an impact on what things get passed or not. And
Mm.
like just because ketamine is your guys' business, you might already be familiar with like some words that maybe people should avoid using and some words that maybe should be considered to be used instead when talking about the plant medicine. Like, I mean, it's not plant medicine, but talking about this medicine or things like that. Like, what are things that can help other people see reasons to take this more seriously, just with how we present it?
Yeah, it's such a wonderful question because words have so much power in our society, and the way we characterize
Mm-hmm.
things often frames all the debates that follow. You know, the one thing, well, one thing that jumps to mind immediately is, psychedelic medicine or psychedelic therapy versus psychedelic drugs. The
Yeah.
word drug just has so much baggage.
Mm-hmm.
We know. But these are medicines when used appropriately, and I
Mm-hmm.
mean that in a really literal sense. They heal and they prevent illness. And so thinking
Mm-hmm.
of these as psychedelic medicines or the process as psychedelic therapy rather than just the substances as psychedelic drugs is very important. you know, on the ketamine side, the very obvious one is Special K or horse tranquilizers. That one, I die a little every time I see a news article about this, and because they just kind of
Mm-hmm.
they can't help themselves. The
Yeah.
mainstream
Mm-hmm.
press,
Get the jab.
ketamine knows as Special K or a horse, and I'm like, man, they use Advil with horses. Do you hear it called, horse painkillers? No, of
Yeah.
course not. It's
Yeah.
stigma, and so I think, and it's the same with MDMA. MDMA, the drug known as ecstasy, or what, come on, let's just have a conversation. We can stop calling X, the platform formerly known as Twitter. We can stop calling MDMA ecstasy. We can stop calling
Right.
ketamine Special K. We all know what we're talking about at this point. Let's just have a conversation about it.
Yeah.
And
Well, what occurs to me though is there's a generational thing there. See, I'm of the generation that was taught to believe psychedelics was really bad shit,
yeah,
But
yeah.
you and Christina are young enough that you didn't get that message quite as powerfully as I did. And so we may have to die off before there's a
Mm.
majority of people that understand that this is not some bad stuff that when properly
Mm-hmm.
used is extremely enhancing.
Well, I
Mm-hmm.
hope that's not what has to happen for this to translate truly. but
Me too.
but I do but I do think, there certainly is a generational aspect to it. But by the way, that can work in other directions. If younger folks are too flippant about these things, then we can
Right.
repeat this cycle of it, seeming risky or recreational. The thing we want is for people to know what these substances are, know how to use them, to work with providers, caregivers, others who can enable them to have, great healing experiences with them. And so just as important as it is to not stigmatize them, it's also not to be flippant about them, like any medicine, use as directed,
Well, I
Right.
think I think
Right.
one of the interesting things that has been discovered is that when you use these things just to get high and have fun, that's one thing. But the research, as you indicated a few minutes ago, is showing, and I think John Hopkins has done a lot of work on this. The setting and the intention and the support
Yeah,
Mm-hmm.
makes all the difference in the world as to the outcome.
Mm-hmm.
absolutely. For
Mm-hmm.
better or for worse, there are people using psychedelics recreationally, MDMA, others. I have not seen data suggesting that people who use MDMA out at a club have any less depression or anxiety or trauma, but we
Mm-hmm.
do know that people who use in a program with facilitators who know what they're doing and set them up for
Right.
success do have life-changing results. And so just
Mm-hmm.
taking just the same way it's not another daily pill, like an SSRI can be a good thing, we also
Uh,
need to know that you can't just take it and hope to feel better tomorrow. There has to be a process, there has to be a protocol, there has to be intentionality around it in order to get the
Mm-hmm.
benefits.
so
Mm-hmm.
you alluded to this a little bit ago, but what is the protocol that Mindbloom uses for that purpose?
Yeah. So the basic structure is 6 ketamine therapy sessions, a few consultations with a psychiatric clinician who evaluates whether someone is a good candidate for treatment and issues a prescription at the right dose for them. And also someone called a guide who is really a coach and is there to help people with preparation and integration and support them throughout treatment. We also have someone called a peer treatment monitor, who's a trusted adult friend, family member who's physically present with you during treatment, because all of our programs are done through telehealth. So the way it works is you can fill out an initial survey on the website to see if you meet some threshold eligibility criteria. If you do, you can see a clinician who does the full intake paperwork, full medical psychiatric evaluation. And if someone's a good candidate, they can prescribe an initial limited dose, usually 1 to 3 doses, which is delivered to the client at home. Before the first session, the client and their guide will meet on Zoom to do some preparation work before the session, setting intentions, also checking blood pressure and heart rate, making sure you're physically in the right place to begin treatment. The medicine is prescribed in 2 forms. It can be a sublingual tablet that you hold under the tongue and then spit out, or subcutaneous injection, which is something new, but it's just a tiny insulin needle that you stick into your tummy. And you take the medicine, put on an eye mask, and turn inwards. We have these incredible audio library developed by a music therapist with a number of different types of audio tracks, and also preparation and integration content developed for specific issues. So sometimes it's diagnoses. We have programs for depression and anxiety, but also things like getting unstuck, beating burnout, managing things like that. And so you choose a program with content that's suited for you. You have that audio going, you turn inwards for about an hour. When the medicine wears off, you then journal, and we have prompts and other things that we give you to guide your journaling. But really, this experience is so surreal and psychedelic and unique that you often you can't wait to get your pen out and start writing down the thoughts you had, the things you're feeling. And it kind of spills out of you. I'm not one who's normally a journaler, but after a Mindbloom session, the words just pour out. And it's so fascinating to see what comes out, because it's not that normal process always of like thought, hand, write. It's just streaming out. And when you have those thoughts, you're often surprised. Sometimes it's things that came up already. Sometimes it's new things. Like, this process is kind of ongoing with your eyes open. But you get this stuff down on the page, and it's often this like, holy cow moment. And you often revisit that stuff later, and it's like, wow, yeah, I remember what that felt like. You can bring yourself back to feeling acceptance or self-love or excitement, purpose, possibility. And so after you journal for a bit, you then get back on Zoom with your guide and start the process of integration. And you unpack what you felt, what you saw, what you experienced. And that process continues after the session to kind of turn that into lasting change. So you do 2 sessions, then you have a follow-up consultation with your clinician. How was the dose? Were there any issues, side effects, things like that? And if everything is going smoothly, you continue treatment through that 6th session. You do additional integration with the guide throughout the program. And we also have group integration circles, which people can sign up for and join at any time, where a guide leads a group of, 2 to, I forget what the max is, 7 or 8 people who get together and share their experiences and talk through it, which is a really powerful tool for people, because this is such a unique experience. Most people haven't done psychedelics before. And so to get to talk about it with other people who are going through it at the same time is really special. You hear people say things that often you can reflect back and say, oh yeah, I guess me too, or oh,
Right.
not me. That's interesting. This reflective process is really valuable, and being heard and having other people hear and acknowledge your experience as you're going through this is incredibly validating and helpful. And so, the program starts with those 6 sessions, the guide work and the clinical consultations, the content in the app and the group integration circles. And, from there, people can continue treatment. Some people stop, some people revisit after a few weeks or months. I'll often do a group of sessions and then wait a few weeks or months and then, revisit it when either I'm feeling more anxious or, something else is going on. But there are lots of different paths people take. It's not, always linear, but it's been incredibly powerful. We've published 2 peer-reviewed studies of our outcomes. The most recent was published in June with data from 11,441 clients. And it showed that, 62% of clients have clinically significant improvements after only 4 sessions, and fewer than
Wow.
5% side effects. So we're talking about something that's remarkably effective, fast acting, and safe. And through telehealth, we've been able to make this way more accessible and affordable than it ever was before.
Mm-hmm. That's so cool. That's so
Another
neat.
question,
Yeah.
Christina?
Yeah, you mentioned side effects. What side effects are people most likely to encounter and that they should look out for so they can talk to their doctor about it?
Yeah, I think the most common one would be nausea. Our clinicians
Mm-hmm.
often will prescribe ondansetron or something else as preventative measure for nausea. That, when it happens, usually resolves quickly. By the time the medicine wears off. Sometimes people can have headache, and sometimes I think the psychedelic experience can be sometimes challenging. It isn't for most people, and the work our guides do to help people prepare is part of what's so important for that. But this is a mind altering medicine. It does alter your
Mm-hmm.
consciousness. So in a
Mm-hmm.
way that can be incredibly healing, but it's why it's so important to work with great clinicians and guides who can, get the dose right, help you prepare mentally, cultivate that right physical setting, and be
Mm-hmm.
in a position to succeed. But the side effects really do tend to be very rare, very mild, and very short-lived. Ketamine, a lot of people don't know this. It's actually on the World Health Organization's list of essential medicines because it is
Well,
so valuable and safe. It's in every ambulance you see driving down the street. It's in every
Wow.
emergency room. And for mental health, it's used at a fraction of the dose as it is for anesthesia or analgesia. So literally a tenth of the dose. And so the part of the reason it's so safe is it's already safe at that dose, and we're doing it at a tenth of the dose.
Yeah, that's neat. And I will say
Yeah.
this, as a body worker, any situation where your consciousness is starting to kind of like change or you feel like your consciousness is lowering, it does actually help the non-conscious speak louder. So even
Mm.
I'm just saying like yes, if you have nausea, hopefully it goes away and you're not uncomfortable, but know that even that can be something that can be used by your body to promote
Mm.
that voice speaking through and pointing you in the direction you want to go.
Absolutely. And I think the reason companies like Mindbloom exist is that there are skills just like that you can be taught and cultivate and can help you get more out of these experiences and medicines. And so you're absolutely right.
Mm-hmm.
And working with people who know how these work and can facilitate their use is so different from trying to do something on your own and kind of
Mm-hmm.
self-medicating or going through it alone.
Yeah. Yeah, and
so
just missing out on the benefit of having a team working for you when you know that not all things are like working right inside of
Yeah,
you
absolutely.
at the time. So,
so
what were you going to
before
say,
I
Mark?
ask my last question, I just want to say if people want to get a hold of you, just go to
Mm.
mindbloom.com. Is that the thing to do?
Absolutely. Yeah. We have a ton of information on there about what ketamine is, how our programs work, different pathways we have for different issues people might be facing, testimonials from clients who have gone through it. And certainly it's the best place to start for someone who's curious.
So, for those of
Very
you
cool.
who are interested in this topic and many others we cover on this channel, Christina and I are forming an online community called Thought Masters, and it's for
Mm.
people who want to change their lives and experience this higher consciousness. And we are in the process of doing a founders launch here very soon. And so, if you're interested, you want to get some more information, or you want any help from us, scan the QR code. I'll leave it up for just a second. And there is a form at the bottom of the first page is a checkbox for the founders launch. And this is for people who want to learn our technique for disidentifying with the voice in your head and the lion unicorn model of relationships. So it's going to be called Thought Masters, and Christina and I are kind of excited about it because it's moving right along here.
Very
So,
excited.
so my last question to you, Michael, is you you talk about on your website having partners. How does that fit in to this, and what's that all about?
Yeah. If there are typically the way we've done this, psychiatrists and other prescribers who want to offer ketamine therapy but don't necessarily have training or expertise in it, and don't have people like guides and the support team and the mobile app to kind of provide all of that that goes with the program. If they want to offer it to their patients, they can partner with us to provide the guides and the app and the content and the support to go with them while they maintain their relationship with their patients. We're also moving in the direction of having similar partnerships for therapists and others who aren't prescribers themselves. That's something we're building out
Mm-hmm.
right now. If people want to get in touch on that front, they can email partnerships@mindbloom.com, and we'd be happy to provide some more information, because in addition to wanting to empower people to get this treatment, we want to empower providers to offer it and others to their patients as well.
Mm-hmm.
Super.
So cool.
Anything we've missed, Michael, you want to cover before we wrap this up?
I don't think so. This has been wonderful. I think, this is such an important conversation about, what these medicines are and how they can help people. And I'm so grateful for the time today to really talk through them and also share my own experience. You two were just incredibly generous in uh, letting me share that, really in the hopes that it helps other people feel confident that they can get help too and overcome things that, like me, maybe they've struggled with for decades or more. So thank you both so much, and thank you for all the work you do to let people become thought masters and improve their lives.
Oh,
Well,
thank
thanks for
you. And
coming. Yeah.
if if you would, when we wrap this up, just hang on for a second. And
Happy to.
those of you who want to read some interesting stuff, not about psychedelics, but about many of the topics we talked about, here are my books: The Dance of the Lion and Unicorn and Mastering Thought and Awakening. There is another book I can talk to you about. Feel free to contact us. And Christina, anything on your plate before we say goodbye?
I'm really looking forward to integrating this information.
Awesome. This has really been a pleasure. Thank you both.
It's
Yeah,
our
it's been
pleasure.
great
Thanks
having
so
you.
much, Michael.
Hmm.
Bye bye.